Okay, let's talk about another medical procedure known as the upper gastrointestinal endoscopy. All right, so in this endoscopy, you are doing an endoscopy of the gastrointestinal tract, quite all right. But you're trying to just focus on the upper gastrointestinal tract. Okay, so in this upper gastrointestinal endoscopy, we'll be talking about this whole process and everything. Okay, and we go from definition, we go to the purposes, like why is it used. Okay, they go to the procedure, go to the preparation of the patient, performed procedure. Okay, I think performed procedure is for diagnostic purposes. All right, then this procedure is kind of like how you do the whole thing. All right, and that will be all. Okay, so coming here talking about the definition, we say that upper gastrointestinal endoscopy is actually a procedure that uses a flexible tube. This is a flexible tube. All right, and this tube actually has a camera at the tip. Okay, so this flexible tube has a camera and light at the end or at the tip. Okay, so as you are going through this patient, okay, it's like a tunnel you are watching on the video. Okay, so as you are going through that patient, you are watching on the video and all that. All right, so that camera and light is just to visualize the upper digestive tract. Okay, and the upper digestive tract include the esophagus, the stomach, and the duodenum, specifically what the first part of the duodenum. All right, so you are doing this kind of procedure for reasons like what you want to diagnose some disease conditions, right? So disease conditions like what gastroesophageal reflux disease, peptic ulcers, inflammations like gastritis or duodenitis. Okay, that's inflammation of the duodenum, or gastritis, that's inflammation of the stomach. Right. Then you're also doing it to diagnose disease conditions like cancer, celiac disease too. All right. Then you're also doing it to investigate symptoms like what, if patients just randomly just say that they have abdominal pain. The abdomen is stacked up with so many organs, so you are doing it to know which one is affected. Okay, then you are doing it for nausea and vomiting. You are doing it to access difficulty in swallowing. Okay, then you are doing it to what, access why there is bleeding in vomit or why there is bleeding in stool. Okay, so those are just perform procedures like you can use it for biopsy, polyp removal, stent placement, and dilatation or stretching of the narrowed areas. Okay, then preparation, if a patient is actually opting in for this upper gastrointestinal endoscopy, the patient should not eat food or drink for like the last 6 to 8 hours. Okay, sedation is optional. You might want to make the patient sleep with anesthesia, is optional. Right, then they should remove dental appliances, glasses, and contact lenses. Okay, the procedure, you insert the endoscope into the mouth, you start visualizing the gastrointestinal tract on screen. Right, they could do a biopsy if necessary, if you want to take up some tissues just for laboratory tests and all that. All right, then after you're done with all this, you now remove what, the endoscope. Okay, so guys, that's it about what upper gastrointestinal endoscopy. Okay, we basically spoke about the purpose, uses, and procedure. All right, so that's it. See you guys.